Save My Piggies, Your Life, Your Limb, Your Story, with hosts Interventional Cardiologist Dr. John Phillips and Global PAD Association CEO Kym McNicholas.
Welcome, everybody, to another edition of Save My Piggies. This is a podcast interview that is devoted to patient advocacy for cardiovascular disease, but oftentimes we're talking to folks that have peripheral arterial disease. We let them tell their life, their limb, and their story. And I'm always honored here to be next to my we're across the country, but Miss Kimberly is joining us, and we have a special guest, Dr. K, as he's known to me, from Germany. He was just one of our PAD award winners. And our guest today is Veejay, who is joining us from the UK. She's actually on a treadmill for those of you watching on our YouTube channel. Veejay, welcome to Save My Piggies. Tell us your vascular journey from the beginning. We're dying to hear. Super inspiring, I heard.
Since Veejay is on her treadmill, I'm on my walking pad
yes.
as well. So Veejay, you already inspired me to get my butt off the couch and
Fantastic.
walking as well.
It always comes as a surprise to everybody because all my meetings with work now, I'm always on the treadmill, and the first question people say to me is, "Are you on a treadmill?" And it's a wonderful way to get your step count in. I'm just saying, even if you haven't got pad, it's a wonderful form of exercise. But in terms
Great
of my
way to prevent
journey, I'm always happy to share it because it was so
Please.
unexpected, and I'd never heard of pad before, a week or so before my formal diagnosis. But for me, I'd always had quite a sedentary lifestyle. I'm an academic, so I spent my life sat at my computer. And then about 6 or 7 years ago, I just started trying to get a bit more active, a bit more exercise into my life. And that was going well. I had no issues. And I found I had quite a lazy summer, and I don't know if it was related or not. I had quite a lazy summer, and my exercise took a back seat for a few months. I was away traveling quite a bit. And then when I got back from my travels, I just went for a walk as I normally would do. And I just found that my legs started hurting. I just started getting cramp in my right leg. So I assumed I'd just maybe pulled a muscle. Maybe that's what the problem was. So I started taking it easy for a couple of weeks and just focused on swimming versus walking. But after about a month of resting my leg a little bit, it was the same issue. I'd set off walking, and then within about 3 minutes of walking, I'd get cramp, really severe cramp in my leg, and force me to stop. I'd stop for about a minute, and then when I started walking again, I'd be fine for 2 or 3 minutes. And it struck me as odd, so I actually went to the doctors about it. And they went from sciatica, and then they said I'd maybe worn out my hip bone from too much walking in the past. So they sent me for x-rays on my hip bone, and that came back perfectly normal. And
Veejay,
in the
real
meantime,
quick, I don't mean to interrupt you, but I think this is
absolutely,
important, and I would imagine Greg would agree with me, or Dr. K. Did your physician touch your arteries or do a vascular assessment during their exam?
they did absolutely nothing. They just asked me to explain my symptoms, and what really pushed me to go to see the doctor is I'd noticed that my foot was going a bit numb, and I was getting pain in my back, my lower back, and I noticed that my right buttock was also going a bit numb and tingly. I explained all of those symptoms to the doctor, and they said it was sciatica or hip. And I wasn't happy with that explanation. As a researcher, I went off and started doing some of my own research, and I accidentally stumbled across this paper on intermittent claudication. And I thought, oh, what's that? So I read more about it, and it said it was linked to peripheral artery disease. And I thought, that can't be me. I'm young. I'm not overweight. I was a smoker, and I had been a smoker my entire life, but I didn't think it was something that would be relevant to me. And I put it to one side for a few days, but it just kept on niggling me. So I went back and thought, well, what are the symptoms of peripheral artery disease? What is it? And how would you know if you've got it? And then I came across the ABI test, a description of it online. And I just sat there. I thought, I'll see if I can find a pulse in my foot. And I couldn't find a pulse in my foot. So that kind of set off real alarm bells. So I went back to my doctor and I said, humour me. I know I'm talking crazy and it can't possibly be this. And he smiled at me and I said, I know it's crazy. And he said, you're too young, you're too healthy, you're not overweight. It's not going to be that. I said, well, just humour me. I said, will you just find the pulse in my foot? Just so to give me that reassurance. And he said, certainly. And he led me down on the bed and he started feeling around on my foot. And then he went up behind my knee. And he was taking some time doing it. And that kind of made me a bit concerned. And then he said, sit down. And he went, yeah, you're right. He said, I can't. There's a very barely palpable pulse in your foot, a very weak one behind your knee. I'm going to make an urgent referral for you. And within 2 weeks, I got a referral. So I consider myself really lucky. I went to the vascular clinic at the hospital and they did a scan and an ABI test. At rest.
And you consider yourself lucky because of the health, the health system in the UK with respect to timing to that referral, or they caught
Yes.
it early?
To get an appointment within 2 weeks of your doctor sort of referring you, I think is phenomenally fast. Now, to be fair, they did ring me and say your appointment will be in about 3 months. And I said to them, where can I go to get a quicker appointment? I'm willing to travel. And I only had to go 25-minute drive to get to the hospital. And I was able to get a much quicker appointment by being flexible in my ability to travel.
Greg, is that consistent in Germany?
Yes, actually, yes. So, Veejay also, hey, hi from my side. So you get a self-diagnosed, right? So it's a different setting because you're academic. She's knowledgeable. She's herself doing research, but I think it would have been a whole different story in case she didn't have these qualifications. And in Germany, something like that, for an angiology specialist, you normally wait something like between 3 and 6 months. Yes.
Yeah. I do
And
feel
is that that's without a wound. So if someone doesn't have a wound on their foot, so advanced stage
Without
PAD,
a wound,
it's
yes.
known as critical limb ischemia, and that's if you have a wound that's not healing on your foot, and or rest pain that is waking you up out of a sound sleep. Then you would get in early.
I do think the fact that I was very calm, I wasn't sort of panicked about it. I was very calm, very measured and very knowledgeable, and I knew the terminology. I knew what to ask for. And that's a perk of my career, being a researcher. And
Right.
I think on that basis, he took me seriously. And that's why he did do the check for my pulse in my foot. So I agree.
Was there a moment with him where he may have apologized, said, whoa, actually, whoops, missed that?
He didn't apologize. He was more just very impressed that I'd done the research enough to find and basically diagnose myself. He was just very, wow, well done you for sort of stumbling across this and doing your research, and was just more impressed. I did speak to the doctor who said I had a worn hip bone, and I said, oh, by the way, it's PAD, after I'd been diagnosed. And she was like, oh, that's crazy, I can't believe it. And she just was very dismissive about the fact that she'd actually misdiagnosed me. And had I not done that research, I would have been going off for treatment for sciatica or a hip bone. But I do consider myself lucky. I got a very quick diagnosis.
Yeah.
They did the ABI at rest, and that came back at 0.81. And then I did 10 minutes exercise on a treadmill, and it dropped down to 0.51. So, and again, I think I was very fortunate because I got some wonderful advice from the specialist. He said, because my impression was just put a stent in, problem solved. I hadn't really researched the treatment. I'd just researched the diagnosis. And he said to me, it's a bit like a get out of jail card. He said, nobody can predict how long the stent will last. And really what you want to do is try and delay surgery or any kind of intervention until you're at the point where your pain level is too high and you can't really live a day-to-day life comfortably. And if you get to the point where your life is so interrupted by the pain, come back and we will discuss some kind of intervention. But if you can manage and you can cope with it, I wouldn't do anything as yet because you're so young. I was 45 at the time.
So they talked to you about risk factor modification? Did you stop smoking, I imagine, or?
I walked into the appointment, got my ABI test. I walked out, and as a chronic lifelong smoker. The first thing I did was pick up my packet of cigarettes. I took one out and I had my lighter in the hand and I was about to light it. And I thought, if you don't quit now, you're never going to quit. I threw them in the bin. I got home, threw out all my ashtrays, all my lighters, all my cigarettes, and I've not had one since that day. I've not had one since before I walked into that diagnosis.
And how long has that been now?
3 years next month.
Oh, congratulations. What was it about that mindset? How did you handle the cravings? Because what we hear is you still get cravings afterwards, and you have to find ways, because a lot of people end up picking up the cigarette when they're stressed, when they're anxious, and life is full of those types of moments. So did you have any sort of moments where you wanted to go to the store and go pick up another pack? Or
No.
were you just pretty much, you're just like, I want my legs?
I want my legs. And I think the problem when you try and quit smoking and you don't manage it is because you entertain the idea in your mind. It's an option. And I think for me, that moment, I looked at that cigarette and it's like, this is not optional. It's just not optional. And whenever I thought, oh, I want a cigarette, it's like, no, it's not an option. It's just, I don't entertain the thought. I don't have the thought and go, but I do want, it's like, no. Cease the brain pattern, cease the thought process. The minute you start thinking about a cigarette, contemplating going to a shop, you've lost half the battle. Then I think you've then got to really suffer the bad craving. I'm a psychologist, so I strongly believe in mind over matter. And in my view is if your mind tells you you could have it, you might want one, it's an option, then you're just going to feel a lot more physiological symptoms and cravings. So I just knew in that moment, I can never smoke again. Not optional. Goodbye. See you later, cigarettes. Never again.
So what was the conversation like with your doctor when the doctor said, okay, well, you need to go home. You don't want a procedure because it'll just lead to a revolving door of procedures. They just don't last very long. What were the specific instructions by him for you to handle things on your own?
None at all. Nothing. He just said, just try and be as active as you can and exercise. But there was no specifics about what exercise I should do. There was no guidance on what that exercise program should look like. Nothing.
Greg, what would you say to Veejay if you were treating her regarding what type of exercise program and how often, how long, what to do?
I think Veejay did it right, obviously, but we would advise the patients to do at least 40 minutes exercise and at least 3 times per week. And of course, with exercise, this is the cardiac training, but with PAD training, you also need to push the limit. So you need to get the pain, the ischemic pain, and then go on as far as you can and push it every day if possible. May I ask you something else, Veejay? Did you get some medicine prescribed, like aspirin or a statin?
80 milligrams of the atorvastatin and 75 milligram of the clopidogrel, which is the blood thinner. I started the blood thinner the same day. I hesitated over the statins, I won't lie. I went off and did quite a lot of research on the statins for a few days, trying to decide whether that was the right course of action for me. I was aware that I was only 45 at the time, and I knew that once I started them, it was going to be for life, if you will. So I just wanted to make sure that the statins was the right choice for me. And after reading a few papers about the benefits, especially of an 80 milligram dose, because I contemplated maybe having half that dose, and the research seemed very favourable towards the 80 milligram dosage from a very early stage. So after about 4 or 5 days, I think it was maybe 5 days, I then started the statins. And I take those daily and have done for 3 years.
Would you prescribe the same thing, John?
Yeah, I mean, I would definitely recommend an antiplatelet.
Right.
And then the cilostazol or Pletol, assuming heart pump function was okay. And then, yeah, definitely is a statin. I would check her lipid profile. Lately, I think have been looking at lipoprotein little a, ApoB, because really what you're trying to do here is reduce her cardiovascular events and prevent heart attack and stroke. So I think that's really important. Also counsel the patient on, you know what, you might get some myalgias or muscle aches when you take a statin, and mitigate that with coenzyme Q. But I don't, I don't subscribe. I tell my patients that the body needs cholesterol, and at really high doses of statin, the brain needs cholesterol. So I believe there has been some documented issues with folks having some word finding problems on long-term high dose statin. I don't buy into the Alzheimer's bit. I don't buy into the if you're pre-diabetic, you'll become a diabetic a few weeks earlier if you take a statin. I don't believe that statins cause diabetes. It might accelerate it. And I think there's just more bang for the buck. And if patients don't tolerate it, then I send them to our lipid specialists for a PCSK9 inhibitor or something along those lines. I'm a really big believer in them. And I don't like prescribing meds for patients because, compliance is an issue. And, you see these folks, they have a litany, a page worth of medications. And, how can you remember to do that? So I try to be a minimalist, but I do believe in statins and antiplatelets for reducing cardiovascular risk.
There is a family, my mother had a heart attack when she was 49, and she'd had a triple heart bypass by the time she was 52.
Oh, wow.
Yes, and so hyperfamilial cholesterol, it runs in the family. One of my sisters has got it. Her cholesterol, I don't know how it converts into different countries, but hers is 9, which is very high. The recommended shouldn't be anything higher than 5. My cholesterol has been tested over the years, and it was 5.1, so it was never flagged as an issue. So I never had high cholesterol, if you will, but there is a family history of early heart attacks. So they did check my heart, and I've had quite a few tests just done on my heart. The 24-hour testing, and went to the hospital for some scans, and that all came back clear. But I think maybe with having the familial history of heart issues made them really kind of sit up and think, right, what can we do? They just threw everything, the strongest, highest dose they could give, just to try and catch it early.
And Veejay, you bring up a good point, and Greg, I'd love to hear your thoughts. I lately, over the past couple of years, have been more aggressive with ordering stress testing and scanning carotids in people who have peripheral arterial disease. And I think there's a healthy debate about it, because ideally you get them on the right medications. So if they're not having any symptoms and you do a stress test and it's abnormal, what do you do? That's always what I sometimes struggle with. But again, we miss it, and I think we have to be on the lookout for this, because that's the demise of a patient with PAD. It's not the blocked iliac artery or whatever. It's the coronary disease or the stroke.
But if they're not pushing it, the issue that we talk about all the time in our network of patients is that when you have PAD, you're not necessarily pushing it as much as you probably could be pushing it or should be pushing it to trigger that angina until you go in for a stress test. You're a little bit more conservative when you do have PAD and you're out walking, as much as you're trying to trigger that claudication, walk at a pace to trigger that claudication sooner versus later. You're still a little bit more conservative, and you may not be getting that cardiovascular workout while you're out there until you go in for the stress test. And so, if they go in for the stress test, they have that abnormal heart. I think that is a really big red flag, because as they progress with their walking ability through all of those walking programs, you don't want them to suddenly die from a heart attack because they finally triggered that cardiovascular level out there on their own on the street, right? And we've had 2 patients have that happen too, unfortunately. They go in, they have their leg procedure, they get out, they're excited, they start walking again, and then boop, gone.
I sometimes wondered if I was pushing myself so hard with my mountain climbing.
So we've got to rewind there. So
how did you even start walking? Where did you get the idea that you needed to walk? Not just exercise, but you needed to walk.
Well, I found the pad group, and I was walking. It was strange because I had the day before the diagnosis, the leg cramp hurt so much that I just stopped walking for a few weeks. It just hurt. But the minute the doctor said to me, no, it's safe to walk, just keep doing your exercise, whatever you're doing, it was like the pain became manageable then, because it was good pain. It was productive pain. And it wasn't, I think as you're always told that if something hurts, you should rest it. It's bad to keep pushing something that hurts. So before I was diagnosed, I thought, oh, I mustn't do anything because it's hurting and I could be doing more damage. Once I was diagnosed, I knew then that the pain wasn't a bad thing. It was a good thing and it was going to be productive.
So Veejay, as a psychologist, unpack that statement for me, because I imagine you probably introspectively kind of think about good pain, bad pain, because we have a lot of patients that it's just pain and like that's not good. So did you ever like use your skills as a psychologist to then actually get you personally to think, okay, let me do this. This makes sense from a not only physical but psychological standpoint. Does that make sense?
It does make sense, and I think it might shock you that I'm a forensic psychologist.
Oh, okay.
And my specialism is serial sexual offenders. So it has no relevance to health psychology or anything. But one thing that I do coaching with victims is that good things can come from something bad. And you can develop strength that you didn't know you had, resilience that you didn't know you had, resourcefulness that you didn't know you had, survival skills that you didn't know you had. And they're a perk. It's an awful thing that happens, but you have the negative consequences of being a victim, but there are actually positive consequences in that the skills that you gain. And so I don't always see a bad thing being a bad thing. A bad thing can become a good thing. And so maybe it's that same kind of mindset, whereas the pain is a bad thing, but it can actually be a very good thing and a very productive thing. And I can use that to fuel a great, they call about it positive growth. Something positive can grow from that. And so once I realised that the pain wasn't doing any more damage and actually could go on to do something good, I just threw myself straight in there. And the next day I went off walking for an hour and it hurt. But I think if you're mentally able to prepare yourself for the pain you're about to face with, and you know that it's a good pain, then you can keep going. And I just kept on going and going and going. I'm still going.
But that's where you were in.
Haven't quit.
You were in, you went into the PAD supportgroup.org through the Global PAD Association, and that's where you learned that you needed that the pain was a good thing and that you should push through the pain.
Yes, exactly. That's exactly right. It's the group has been fantastic for me. It's been so informative. Not only on an emotional level has it supported me. You'll never remember my first post because you get so many others, but my first post was, oh my goodness, this is awful. I felt like my life expectancy was really short. I think Google sort of gives you the impression that 3 to 5 years is your maximum. And I kind of came into the group with this kind of blinkers on, as in this is what's going to happen to me very quickly. And to have, I think you were one of the first persons to reply was yourself, and you said, oh, we've got this 70 or 80-year-old woman been diagnosed decades and she's off there walking every single day. And it was like, and that gave me the reassurance. Immediately I felt so much calmer after that actually this wasn't the end. And I had so many people coming in. Kathy was definitely one of them. Telling me her story, and then
she's one of our admins,
But so did you?
Really informed.
Do you have to weed through? I imagine there's a lot of noise out there on the internet and Facebook and Instagram or whatever. Like, did you find some groups that were just really out there, and how did you kind of center in on Kym's group?
I think I'm a very lucky person in life. I'm not lucky I don't win money, but I'm lucky in that life just seems to have send me little guardian angels. I had a very adverse childhood experiences, and I always had a guardian angel who just helped me through in different ways. And they were real people who just come into my life, and I get lucky that way. And I stumbled across Kym's group, the first group I came across, and I just felt a real kinship with that group. immediately. And from that day forth, I've never searched any other groups.
Okay.
And I've not Googled PAD, I've not searched PAD, because the group gives me all the information, and I know it's very factually accurate, the group, the information that I get from that group.
Douglas and
we
Beth
get
are
it straight
sending you
from the
some
doctors
hearts.
and the PAD guidelines. And
Yeah.
Douglas, who's also in our group, Douglas is one of the, our warrior chief in the group, and he's always very supportive and is all about the confessions of a walkaholic and putting tips out there and sharing his story. But I'm curious, the funny thing to me, which I had never heard from you guys before until just we have our weekly UK hangout, which we need Dr. K to join at some point. That would be really fun. We have a weekly hangout that is virtual, and Veejay shared this really funny story. You got to a certain point, right? How long, from the point that you were having claudication every few minutes to the point where you're like, oh my gosh, I did it. I can walk 30 minutes or 60 minutes without stopping, and I'm great. I've been there, done that. I'm golden.
Yeah.
And then in
Exactly
comes
that.
our admin, Kathy. Bring
It
us
was
back
about
to that.
6 months. It was about 6 months into it, and I could do all my normal walks again, and everything was great. So I came in to make a post-it. Yay, fantastic, everybody. Guess what? The walking program works. It's all great. Excellent. I was just really happy. And Kathy just came along and she said, wonderful. Yay. Well done, Veejay. But if it's not hurting anymore, she said, you need to go out there and find yourself a mountain. And I'd never climbed a mountain. I'd never hiked up a mountain before she said that. And I just really, and I messaged one of my friends who I knew was a hiker. I said, I need to find some mountains. So, do you know any mountains that we can go up? And she said, yeah, I know one. And so we did one, and it was really hard work. Really, really hard work. My leg hurt instantly. As soon as I hit the elevation, the cramp came straight back in my leg, but we managed it, and then I just got hooked. I loved the views at the top. I loved the exhilaration that I felt. I loved the views. It was just such a wonderful feeling of achievement to climb a mountain. So then I said, what's the highest mountain in England? And she said, it's Scafell. I said, we've got to do Scafell. So a few months later, doing a few others, and then we conquered. A year to my diagnosis, we did Scafell Mountain, the highest. I was the highest person in England that day.
Oh, how high is it?
It's 1,000, around about 1,000 meters. I don't know what that is in feet, but we go in meters here.
Yeah.
Fair
Okay.
enough.
Yeah. And then after that, I joined a hiking group that focused on mountain hiking. And so every Saturday, I joined the group, and full of strangers, and just had to turn up and go, hi, I'm Veejay. And we just went mountain climbing every Saturday. And I met some wonderful friends. And we formed our own little group. And now we did loads more mountains. And then we did the highest mountain in Scotland, did the highest mountain in Wales. And then I went to Madeira and I did the highest mountain in Madeira. I did it in Barcelona. And then one of my friends said to me, have you ever heard of the Wainwrights challenge? I was like, no. I said, it's 214 mountains in the Lake District. You have to do all of them. So 18 months later, I've got my medal. I've done all 214 mountains in the Lake District. Most of them solo.
This is incredible.
And most of them solo through winter, navigating myself. And I never used to drive anywhere. I was quite a nervous driver. I've had to drive myself to some very remote spots, learn how to navigate mountainous terrain. And I've had a brilliant time. I've
You
loved
did
every
this
minute
by
of it.
yourself? You didn't have a walking companion?
For about 150 of them, I did myself on my own. I know.
It's hard enough for people that have the intermittent claudication and this leg pain, to walk normally. And there's this fear that of being alone and not being able to get back. Did you have that fear at some point with these mountains that, oh, shoot, I'm going to get to a certain spot. I'm going to get claudication so severe. How am I going to get back?
Pain will never stop me, Kym. No, pain will never stop me. not at all. That was never a fear that the pain would become too much. That would never be an issue.
Wow.
My fear was getting lost. that was my fear. Or driving down one of those very narrow roads and having an oncoming car and having to reverse to get out of the way. Those were my fears. Pain will not stop me. No, that's not a fear for me.
So do you see a vascular specialist on a yearly basis? Do you get checked in, or are you just on cruise control now?
I was meant to see a specialist 6 months after my initial diagnosis, and I didn't get an appointment through. So I rang them after about 8 months and said, I've not had an appointment yet. And they just said, sorry, we're really busy. We will send you on. It got to about a year. I rang them again and they just said, unless you're having any serious problems, but we'll get to you. We'll get to you. And I wasn't too worried because I was fine. And I know the system is overrun at the moment, and I didn't want to take an appointment from somebody who needed that appointment.
Yes,
So I just left it till about a year and a half. And then I phoned them up again and just said, look, it's been a year and a half. I do feel like it should have been after I was told after 6 months. So I went to see him, and he was just flabbergasted. He said, I'm the poster girl for PAD.
Okay, you are. You're the poster person. Doesn't mean male or female.
He just says, you're doing fantastic. I read his report afterwards and he said, she's climbing mountains. She's doing brilliant. You're absolutely fine. He said, what I want to do, and Kathy again had warned me this might happen. She said, because you're doing so well, when you have your appointment, they might say, how about we discharge you? And she said,
yeah,
I can understand why you might be tempted, Veejay, because you're doing great. She said, but things can change quickly, and you might find then it takes time to get back on the system. So when I was in this meeting, he said, you're doing brilliant. He said, how about we discharge you? And I thought, Kathy warned me about this. So I said to her, I'm not very comfortable with being discharged. I said, because everything's great, but it could change quite quickly. I said, so I don't need to come and see you every year, but I want to stay on the system as the PAD patient. And he said he was absolutely fine with that. He gave me his direct number and he just said, I won't call you in every year. He said, but if you're having problems and you need to see me, here's my number. Okay. And he said, I'll put it in your report or your email. And he said, and just ring me and I'll see you.
We do have a lot of issues with people being discharged and then having some sort of acute situation where, yes, they have the atherosclerosis, but then on top of that, they end up with some sort of blood clot, right through their artery that just creates something acute. And then we're sitting here and we're having so much trouble getting them into the vascular doctor. And it's like, nope, just go to the ED. That's it. Yeah. That's all you can do at that point. So it's really good that you did that. It's great. Do you find that having that little extra accountability, though, in seeing a vascular doctor, no matter how well you're doing, to keep you motivated, to keep going and to keep working at it? Or would you rather just be completely left alone to your own devices?
Nobody motivates me like myself. I am self-motivated and I don't need to see somebody to tell me that I need to keep going. What I do is I have my yearly challenge. I've done it 3 years in a row now since I was diagnosed. It's the Yorkshire Three Peaks Challenge, which we have spoken about before. Yeah. I do it the first week of September. And it's deliberately done in the first weekend of September because I can get a bit lazy over my summer holiday. I travel a lot over summer and I find it interrupts my kind of exercise routine and my hiking routine because I'm abroad. I try and hike as much as possible abroad, but it's different. But I keep on track because I know I've got to do that challenge at the first week of September. So I need my fitness levels to be really high to do that challenge. So I've personally set myself this challenge on the first weekend of September. And as long as I can still do it within a good time frame and fulfill that challenge, then that's my motivation.
What challenge is it?
Oh, go ahead.
No, I was curious. What is the challenge?
It's a 25-mile hike. And you have to do it under 12 hours. And it covers the 3 highest peaks in the Yorkshire Dales. So you do your Whernside summit. You then go on to Ingleborough summit. And then you walk to Pennygent summit. So you do 3 mountains in 12 hours over 25 miles.
Okay, cool. Very cool.
Yeah, it's fun. Yeah. And I've always wanted to try and beat myself.
That's incredible.
awesome.
I mean, when you were first starting, just bring us back, I mean, to where you are now. Some people feel like to get over PAD, get to a point where they can live their life with PAD and without the claudication, it's almost like a full-time job. What's the time commitment for you to get to a point where you didn't have any further lifestyle limiting claudication?
It does take time. I mean, again, I'm fortunate in that my job, I've worked for them for 27 years at the university. And when I was diagnosed and I told them, they were just so supportive. They immediately just said, what can we do to help? You tell us how you want this to work. They bought me all the equipment I needed, lots of exercise equipment for my office at home and for my office at the university. They bought me everything. They basically just gave me a catalogue and said, pick whatever equipment you need, we'll buy it. So they bought me everything. I've literally got my office set up here and at my office at work. And so I have this really good rising desk, and I've got my treadmill underneath the desk. And they don't, I can work from home basically. So now I can just, all my meetings, whenever I'm working on any kind of document or anything else like that, I'm just on my treadmill. So if I couldn't do that, that'd be very, very difficult to try and fulfill that kind of exercise quota. No doubt about it. That'd be really, really challenging. If I was stuck in an office, even if you have kind of like a chair, the bicycles or a seat stepper or something like that, I don't think it'd work as well. And they give me flexible hours, so when the weather's good, I can go to the mountains and go hiking in the mountains, and just do my work in the evenings or at the weekends to kind of catch up with it. As long as I'm doing my work, they're happy, and they don't mind when I do that work. So it does take a lot of time, but I'm multitasking that. I do my work while I'm doing my walking.
I don't think anything's going to stop you from walking,
Nope.
Veejay. So you are a poster child for peripheral arterial disease. I want to thank you for being a guest on Save My Piggies. Yep. Greg, thanks for joining us as a co-host. Appreciate it.
You're welcome.
It's not often, Kym, we get to talk to someone in the UK and Germany.
I know, right?
Right.
So
at least we're closer at times.
I'm curious, as we close out, I'm curious though, just final thoughts from Veejay on advice to an inspiration for other patients. That we have had some situations where Veejay almost wasn't going to be posting her stuff because some people were saying, well, it makes me feel bad. You're all the way here doing mountains. You don't understand what it's like. Actually, she does. And that didn't happen overnight. So it's really important for you to, talk straight to the patients, Veejay. Let them know where you began and your best advice to get where you are today.
It's a very I do occasionally feel awkward sort of posting, the successes that you can have. But on the other hand, for those exact reasons, I think it's really important, because when you're a new member and you come along, you've maybe not had the correct information from your specialist and you've Googled, and it's sort of giving you a very bleak outlook. And hope and optimism and embracing the change, I think, is really important to realise that put in the hard work and you can have such a rich and fulfilled life. It's not the end. PAD is not the end. And for me, it was a start of this really wonderful new experience. And so I think if you look at walking as something bad, which is easy to do because it hurts, then it makes it harder. If you can sort of try and change the walk, so go out into the countryside, go and look at the things that are nice when you're walking, and going somewhere different is a very much a cognitive stimulant as well. And so you can pass time and get through the pain because you're busy looking at other things, or going walking with your friends and having a bit of a chat whilst you're walking can be a really useful distraction. So I think distraction, stimulating environment, and seeing where that hard work can really take you. And it can take you to the place where you can start to enjoy walking again as well. And for me, it opens so many doors.
Dr. K, any words of wisdom, final thoughts here before we close out?
I think she's really a fantastic example. So we will wish this for every of our patients. I think many of the things she did also relates to her positive energy. She talked about an angel God, but I think it's not. We can discuss about that, but I think it's more the positive energy she transfers to, and this is why she got all these positive results. So it's really, as I think, this should be really inspiring for every patient with PAD, and I'm really thankful that she shared these thoughts with all of us.
I am as well. Veejay, thank you for sharing your journey with us, both figuratively and literally. And I can't, would love to have you back on. And, next
Anytime.
time when you hit Mount Everest, just snap a photo for us and we'll go from
So
there.
tempted.
Keep us
Now
posted.
yes, you truly are an inspiration, though, and I think
Yes.
we've done a fair amount of Save My Piggies. This is a memorable one for me, just because of how positive you are, and I think it's a beacon of hope and light for some of the patients who are often stuck in darkness. So I'm going to do my best to share this with everyone I know that suffers from PAD. So thank you very much. We really
You're
appreciate
more
it.
than welcome. Thank you for having me and let me talk and share my story.